Well, hello, everyone, and thank you so much for joining us. My name is Rep Buttle. I'm proud to serve as president of the Public-Private Strategies Institute and also have previously served at the Department of Health and Human Services during the Obama administration. Public-Private Strategies Institute, or PPSI, is an independent research and education organization. We engage in educational activities concerning the public and private sectors focused on societal change. Today, PPSI is delighted to be conducting outreach and education for small business owners and advocates around healthcare benefits, trying to better understand the challenges and opportunities and examining what the future of benefits look like, including the evolving link between benefits and employment. We want to let everyone know joining us today that this event is being recorded. If folks would like to ask a question to any of our panelists or presenters, please put your questions in the Q&A box and we will get to tackling those. I want to thank many of our co-sponsors for joining us today and making today's event possible. You'll see them up on the screen. We have the National Association of Women Business Owners, the National Asian Chamber of Commerce and Entrepreneurship, the U.S. Black Chamber, Small Business for America's Future, Women Impacting Public Policy, the United States Hispanic Chamber of Commerce, and Disability N, which is the Disability Chamber of Commerce. Many of them have shared this with their membership, made today possible. We actually are going to be continuing this series with many of them, both virtually, but also live for many of them at their conferences throughout the fall. So we'll be continuing to have this conversation. With that, it is my pleasure to turn the conversation over to our speaker who will be delivering open remarks, Dr. Ellen Montz with CMS. Dr. Montz, over to you.
Thanks, Rhett, and good morning to everyone. It's lovely to be here with you today during this celebration of our National Small Business Month. Just wanted to come and say a few words here. And first, I'll just start with, this Biden administration knows how important small and medium-sized businesses are for our economy and for the livelihood of millions of Americans across the country. And we also know that it's incredibly important for you all to provide quality, affordable healthcare coverage that meets the needs of your employees. And I'm happy that this administration can be a part of the solution to the challenges you all face, whether it's through the small group market or to the shop marketplace or the individual marketplaces. We know that with such a tight labor market, you all, employers, small employers in particular, face significant challenges with finding and retaining talent. And we also know that providing healthcare is an important part of that competition to get the best talent in the workforce pool. And honestly, we know that despite everyone's best efforts, many small and medium-sized businesses continue to not be able to afford to offer healthcare coverage to employees. But the good news is that this is a work in progress, and progress has been made indeed, as our administration continues to support and innovate to help with coverage options for small businesses. Let me highlight a few options we have here. First, we have kind of the more traditional approach. Many small and medium-sized employers continue to find great options for themselves and their employees, just in the small group market and on the shop exchange, and many of these kind of micro employers often find some really nice tax credits to help them with the purchase of coverage. But for some small employers, the small group market isn't the right fit, and I think that's often because small businesses are vastly different as it relates to the varied needs of its employees and its employees' families, vastly different in the different geographic locations, or even sometimes the financial constraints of the employer and really what just makes sense. And so the good news is that outside of the small group market, there are also really incredible options for the self-employed and employers and their employees on the marketplaces, on the individual marketplaces. In fact, I think I've said this to this group before, but small business owners and self-employed individuals make up about 25% of marketplace enrollment, and that doesn't include kind of counting for any employees of small businesses therein. So I think of kind of two options on the individual market for small employers. One, we have these vehicles called ICRAs or QSARAs, and that's really when an employer provides non-taxed reimbursements to their employees for the purchase of coverage on the marketplace. Now, from what I can tell, take up of this option is low, although I think it probably does make sense in some situations for employers to take up this coverage. And so we've been making improvements to the marketplace to help folks better understand this option, but would love to have you all provide us kind of continued feedback on what could make this option work for small employers while continuing to protect the needs of the enrollees in this option. And finally, of course, some employers might find that their best bet is to focus on income compensation or other benefit compensation, and instead helped their employees find affordable coverage on the individual marketplaces on their own. Net premiums are at an all-time low, particularly with the enhanced subsidies that have significantly lowered premiums under the Inflation Reduction Act championed by President Biden. These subsidies have the increased affordability for folks under 400% of the federal poverty level. And indeed, for the first time, they've capped those contributions for individuals above the 400% of the federal poverty level at 8.5% of their income. I think this kind of move and importantness of the Inflation Reduction Act, these enhanced subsidies, is particularly important for small employers and may change the way that folks think about how to best use their funds to compensate their employees. Now, you all are very good at weighing your options and know exactly what each and every one of your employee needs, and therefore I think it is fitting that there are many options for small employers. And indeed, with the finalized family glitch rule, if you're an employer that provides coverage for your employee but not your family, we ensure now that the family members of your employees can get connected to these affordable plans on the marketplace with that financial help that is available on the marketplace. We will continue to focus on making quality, affordable healthcare coverage available for small and medium-sized employers and their employees. And we do this work in partnership with you all. And so we look forward to your continued feedback and indeed your partnership in helping to push our options forward to make sure that small and medium-sized employers can take advantage of these opportunities. Before I go, I do want to do one final call to action. As you all know, the public health emergency has ended, and state Medicaid agencies across the country have begun redetermining Medicaid and CHIP eligibility for every single one of their over 90 million enrollees across the country. And they've done this for the first time in over 3 years. These redeterminations, unfortunately, is putting coverage at risk for millions of Americans across the country. Connecting these folks to coverage, whether it's back to Medicaid or CHIP or other coverage for those who are no longer eligible, is a top priority for this administration. At the marketplaces, we've been preparing and are now deploying our new strategies to help transition folks to quality, affordable plans on the marketplace. But estimates do suggest that the majority of folks that are no longer eligible for Medicaid and CHIP are indeed eligible for an employer-sponsored health insurance. And we're calling on employers of all sizes to do two things. First, educate your employees about their coverage options. Many will need help getting re-enrolled in the Medicaid and CHIP coverage that they may still be eligible for. Some will need help getting to healthcare.gov, and still others will need to sign up for their employer plans, your plans. So I encourage folks to either visit healthcare.gov or medicaid.gov/unwinding to get a bunch of informational materials that you all can use to help your employees. Second, we're calling on employers to use your flexibilities to extend your special enrollment periods for loss of coverage. At the federal marketplace and state-based marketplaces across the country, we have announced that individuals losing eligibility for Medicaid and CHIP will have until the end of this kind of unwinding period, as it called, so about a year from now, to sign up for marketplace coverage, rather than the typical 60 days that we would give a special enrollment period. And we're calling on insurers, plans, and employers with coverage, with health insurance plans available to their employees, to allow for additional flexibility for their employees to get onto your employer plans in what is very likely a very confusing time for Medicaid and CHIP members across the country. I will end by saying that I feel deeply, and I know how important it is for small businesses to know that their employees and their families have coverage that allows them to thrive at home and at work. So I really do want to thank you all for your partnership and all that we do to make affordable and accessible healthcare a reality. Thank you.
Awesome. Well, thank you, Dr. Montz, and thank you, CMS and HHS, for always making time to be with us for these important sessions. I've known Dr. Montz a long time. We worked on the Affordable Care Act together, and she's been highly focused on making sure that small employers have a voice in the process. And so it's great to have you join us. With that, I know that we are looking to get into the meat of the discussion today. And so I'm thrilled to turn the conversation over to my colleague, Emily Barson, who serves as senior advisor here with us. Emily is an amazing expert in her own right in the healthcare industry. In addition to serving at the Department of Health and Human Services, was a founding executive director of a healthcare nonprofit. And so, Emily, I will turn it over to you to introduce our panelists and get the conversation going today. Over to you.
Great. Thank you, Rhett, and thank you, Dr. Montz, for all those really helpful opening remarks. We do have a terrific panel today who will join us to share their experiences and expertise on healthcare benefits. So I will invite our panelists to join us on camera. We have Michael San Juan, who is the president of the Philippine American Chamber of Commerce of Metro Washington, D.C. Katherine Hempstead, senior policy advisor at the Robert Wood Johnson Foundation. And Bryan Giaimo, who is general manager of platform at Stride Health. They all have many more qualifications, and I'll let them share a bit more about their own experiences as we get into it. But I know we have a lot of ground we hope to cover today. So to kick us off, I'd love to begin with a 10,000-foot view of the small group market from each of our panelists, and sort of how your experience and background informs that. How has the market worked for small businesses to date, and what could be improved? Why don't we start with Katherine, and then we'll go to Bryan and Michael.
Thanks, Emily. Thanks for having me here. It's really a pleasure to be on this panel with all these folks and to hear the comments from Dr. Montz. And I think she made a really good point about sort of multiple number of options that small employers have when they're thinking about coverage. And I think a lot of the focus sometimes tends to be on the small group market per se, but that's not necessarily the only place for small employers to look to cover their employees. But just to talk about the small group market for a minute, and I'll be really interested to hear what the other panelists have to say. I think of it as kind of imperiled but resilient, and it reminds me sometimes of the news of my death has been greatly overstated, where I feel like for a long time, people thought the small group market is going to become very, very small, and it's going to basically disappear when the ACA is implemented. This is sort of the beginning of the end of the small group market. But I would say that the small group market has declined, but it's declined much more slowly than people forecast. And I think there's been a more of a consistency with the small group market than I might have expected 10 years ago. That being said, I think there are some challenges with the fully insured small group market. One of which is that it's expensive, and that's something that I know we're going to be talking about later. And there is a lot of exit from the small group market into level funded sort of quasi self-insured plans, which kind of selects against the small group market. At the same time, Dr. Montz mentioned the increase in the subsidies in the individual market. I think there's some forces kind of moving the other way with the individual market, so that at some point we may find the individual market being more consistently more affordable than the small group market, and we're not there yet. But I can sort of see the two markets kind of, moving in those directions. So I think that the small group market is challenged. There are other opportunities for small employers using the individual market directly and through these HRA mechanisms, which are really, really interesting, not just as a tool for small employers, but also as a way to potentially kind of, really build the individual market and kind of think about an alternative to ESI. So I think what happens with those HRAs is really important to us. And I'll stop there and be looking forward to the conversation. Thank you.
Great, thank you. Bryan, your thoughts?
Sure. Yeah. Thanks for having me as well. Really excited to be here. In terms of the small group market, kind of 10,000-foot view, I think what I've observed and what I frankly kind of love about the small group market is that I think these small businesses and their owners and executives, they want to provide benefits to their employees because it's the right thing to do for their bottom line and it's the right thing to do for retention and all that, but it's also just sort of the right thing to do overall. And that really comes through in my conversations that I have in this market, which is really just, it's invigorating, to be honest. I think to the question of how well is it working? I mean, certainly challenges, right? I think in a lot of instances, I don't think it's worked that well, right? Especially for the small businesses, I think, who are just getting started, right? And wanting to okay, I'm new to this market or whatever it is, and I want to provide benefits to my employees, and I really don't know where to start. I don't think those folks are well served right now. So I think the problem is mostly twofold. We mentioned cost. I'm sure we'll talk at length about cost today, so I won't dive into that here now. But I think the other one, honestly, is just really the complexity of it, right? It's a little bit of a black box. Where do I go to turn to for options? Where do I start? Do I call a carrier? Do I call an agency? What is this ICRA thing? What is this QSERA thing? I hope we talk a little bit more about those later today. It's intimidating, right, for a lot of these small businesses, but the desire is there, right, to do something and to do the right thing by their employees. So all that to say, I think one way the market could really be improved is just with more education and guidance, right, from the experts on, for those who have never done this before and don't know where to go first. So I hope we dig into a little bit more of that today. And again, excited to be here.
Absolutely, thank you. Michael, how does the view look from 10,000 feet for you? Oh, you're on mute.
I have to agree with the rest of the panelists, Katherine and Bryan. They provide an insight on what's going on with the marketplace. So with Dr. Ellen Mons, the current marketplace poses a lot of challenges and opportunities. I know a lot of the employers wanted to provide healthcare benefit, but the question is too much a burden for them. Also the way of how can you be competitive? How can you attract employees? How do you retain employees? I myself had those challenges before with my employees. And a lot of the challenges also is like they go to Healthcare Go, but not a lot of people know, hey, what is this? I have some questions. Nobody could provide me enough clarification. And then Dr. Ellen Mons mentioned also, it's a work in progress. I think the only way we could do this, address this, any questions from employees and employers is further education. Maybe we can conduct more trainings. And then if we're well versed on it, we could address the issue. That's my 2 cents.
Great, thank you. Well, I think, unsurprisingly, I think we heard from all of you about the cost and that, really serving as a barrier for small businesses looking at all these various options. And our research from PPSI also found costs to really be small business owners' #1 concern. Katherine, can you provide some perspective on the rising costs in the healthcare space and in the small group in particular and some of those causes?
Yeah, sure. I mean, I think when we look at employer-sponsored insurance in general over the last, maybe 10 years, we've seen sort of a growing gap between public and private provider prices, especially hospital prices, but also physician prices. And we've funded a lot of work in other contexts that look at that dynamic and look at what hospitals are charging and how it's impacted by market power and it's something that I think has led to the transparency and coverage regulations and all this interest in kind of, revealing more information about provider prices. Is it ultimately going to result in anything that's going to significantly reduce them? I think it's a first step. And, we're seeing some places talking a little bit about rate setting and some of the other mechanisms that might actually be able to curtail provider price growth a little bit. But this is, I think, a very front and center issue for employers when they're looking at the cost of coverage. And it's, it's not limited to the small group market. It's an issue for all employers. But I think this, small employers are going to pay more. They don't, they don't have the advantage of scale. And they also, if they're looking at the fully insured market, they're looking at a market that's often, being kind of selected against as healthier groups are leaving to go to these level funded plans. So I think cost becomes, an increasing issue. But I think, and I hope we can get into this when we talk about ICHRA and QSERA. I think that at least my impression, and I'd love to hear more from others that maybe know a little bit more, but it seems to me that when we look around most of the country, it's still the case that all too often the small group market is still cheaper than the individual market. So the benefit of giving people an HRA to go into the individual market is not as advantageous as it should be. But I'd be sort of interested to hear some perspective on that. I think that's one of the things that's sort of impeded the growth of those mechanisms, but there are others as well. And I think the education issue is really key. But I'll stop there. But I think that cost is a problem for all employers and frankly for all consumers in healthcare, which is more expensive than other goods, and the cost is rising more quickly. But it's especially a problem in the small group market, and it seems like that's going to get worse instead of better, given some of the selection dynamics.
Yeah, absolutely. Michael, as the leader of a Chamber of Commerce, what impact do the rising costs have for your small employers and their employees? What do you hear from your members when they're weighing their decisions about healthcare and paying for benefits for their employees and weighing that against other decisions and investments they need to make in their business?
Well, cost is always an issue. What's the impact of this for small business owners? They wanted to offer those benefits, but they can't offer something they could not afford, So the issues would focus on affordability and then quality of health care. I myself, as I hired new people, I'd like to have a good candidate. I wanted to retain this person, but I'm competing against other big time employers. And then I tried to devise ways where I could encourage them, like flexibility with their schedule. Let's talk a little bit more about the family glitch. Let's say you hire this person, you offer this affordable health coverage, but then what's not included is their family. At the back of the head, as a main provider, I would think of my family. If there's other better opportunities for them that they're all inclusive, I would take that route. Now, even though if you go to the marketplace also, I myself had that challenge before because I'm not well versed at that time. So I don't know which one would work because I myself, I'm a diabetic, you know how it is, the cost of medical expenses. And majority of them that I have hired before have their own individual concerns. So I try to be more creative in a way. We focus on different things, the paid time off, flexible work schedule, paid leave, and that's the only way I could compete. But now with Ellen mentioning, Dr. Mons mentioning about certain things in the marketplace that could be more appealing to my employees, we're working on it. We'll look into what works and what doesn't work, what needs further tweaking. I'm open to anything. So we have this open dialogue. So a lot of them, like my members, also go with 1099 because pretty much that's the easiest route for them, because I have to look for both from the employer and employee standpoint.
Yeah, no, absolutely. And I think, you touched on this and so did Ellen. Really, the competitive labor market makes it even more challenging, but also important that, that the benefits structure and package can compete with some of the larger employers. Bryan, I would love to get your input on some of the new options that have become available to small businesses and to their employees to enroll in benefits in recent years, including, well, Michael touched on the fix for the family glitch, but we've also heard a bit about the new health reimbursement arrangement options like ICHRA and QSARA, and sort of what that means for small business owners and for their employees to access benefits through the individual market and the ACA marketplace.
Yeah, absolutely. I think, certainly as an overall point, right? I think the ACA market has obviously stabilized considerably. I would say in the last couple of years, more carriers entering the market, more choice for consumers to get a plan that actually works for them. Dr. Mons mentioned the Inflation Reduction Act, getting higher subsidies for folks, making it a little bit more affordable. So more people getting into that market, and I think having, a further stabilizing effect as well. So I think, for a small business owner, I think, what does that mean, right? For your kind of employees, I think for those that are not eligible for benefits, either because your company doesn't offer them or because you're in kind of a part-time 1099 classification situation, I think it means that they've got options, right? I think as individuals, they can come, go to healthcare.gov or come to a place like Stride Health or whatever it may be and see what subsidy they may qualify for and help get some guidance, right? And figuring out what plan is right for me, get the coverage that they and their families need. I continue to be surprised time and time again how many people we hear from where they say, I had no idea I could get that level of a plan for $15 a month with my subsidy. I mean, it is incredible, right? So I think getting that word out there and helping them understand what it is they actually have access to is really, really powerful. And I think even beyond that, right, there are new mechanisms, like we've mentioned, this ICHRA, the HRA arrangements that provide an additional way, I would say, for employers to leverage those ACA markets to meet the coverage needs of their employees. So I'll talk a little bit about what an ICHRA is, maybe, and then we can probably dive in from there. So an ICHRA stands for Individual Coverage Health Reimbursement Arrangement. Essentially, the arrangement allows for an employer to offer a reimbursement to an employee to go purchase coverage on the exchange in lieu of offering kind of a traditional group-sponsored health plan. That simplest definition, that's essentially what that means, right? So we've seen some interest there from groups that are entirely new to offering benefits and want to offer something, but that's a little bit more affordable. A lot of companies are looking at these as they're seeing small group rate hikes increase year over year. So they're looking for some kind of alternative. And I would say a lot of people kind of liken this shift into, like what we saw in retirement years and years ago, from kind of defined benefit into defined contribution space, where essentially, right, the employer is kind of saying, look, an employee is going to get X dollars from me and can go purchase the coverage that they need and that works for them on the exchange. And I would say, look, I think uptake, Katherine, even to your point, it's different across the country. It kind of depends on state and county and everything else and what the small group rates look like versus individual rates. And that varies. At least from what I've seen, I think for the employers and employees that have opted into a model like this, the satisfaction is actually quite high. There's a lot of options to choose from. I think cost is reduced, certainly for the employer and in some cases for the employee as well. So I think those options definitely exist out there, and I'm seeing some slow and steady growth in this market, I would say, over the last several years in particular.
Great, thank you. Katherine, what have you seen as far as how these new opportunities have been met in terms of interest and enrollment, and what could be done to increase their usage or to improve their utility to small businesses?
Sure. Yeah, I would like to just pick right up where Bryan left off. I think ICHRA is a really exciting idea. I mean, it's an option for small business, and it's also, if you think about it in a little bit of a bigger picture way, it's maybe the beginning of kind of breaking the link between jobs and coverage, which, on the one hand, we're sort of talking about how small employers want to provide coverage to their employees, and that's sort of the American way, but there's another way where we sometimes think, that's not so great because people, maybe feel stuck in a job to get coverage. And, the individual market has sort of shown us an alternative way for people to get coverage. So in a way, we see ICHRA as a potentially very disruptive idea that could really, provide a new way for us to think about where we get coverage and where we work. And it's, the same kind of change that people make the analogy to 401ks. And, for that reason, I think there are a lot of people that are really excited about it. I think, there are a lot of people that oppose it and find it challenging. So it seemed like, the US Chamber criticized it. Labor unions have criticized it because it sort of shakes up the status quo. And I do think that there is this kind of mental space that you provide your employees with benefits, and that's the definition of a good job. So I think it's hard to get people to make this change and say, actually, you can subsidize some of the cost of coverage and let people choose their own coverage. So I think there's sort of a some cultural things and some ideas that need to change to make it more acceptable. And I think some brokers and some benefits consultants aren't advising employers to do things like this. And, but then there's others that like Stride and other companies that sort of see this as a great opportunity. So I think there's some sort of just, dissemination of a new way of thinking. But, I also think that probably still in some markets, it's just not a good trade-off financially, dollar for dollar. But I do think that when it happens, and unfortunately, we have very little evidence on what it's like when it happens because it's very hard to measure. But I think that I agree with Bryan. There is some evidence that it's been a good experience for employees and employers. They both save money. They sometimes buy down to a plan that's a little bit more affordable, and it seems like it's a great solution. But I think that one of the things we learned when we did a study in New Jersey and surveyed employers is how low the awareness is of the existence of this option. And this sort of, brings up the issue about education and, curious to hear people's ideas about how you can spread new ideas to small business. Because in a way, you might think they could be more sort of nimble and flexible because they don't necessarily have big HR departments that sometimes are barriers to change because they have their own interests and their own way of doing things. So in a way, you might think small employers could be nimble and make changes quickly. But I would love to hear more about, what are effective ways to reach small business and talk to them about new ideas.
Great, thank you. And Bryan, I think, building on what Katherine just shared and some of the questions that she raised, I know this is a lot of what you do at Stride Health, of connecting, individuals and businesses with health plans and understanding their options. Does that, can you talk about what you're seeing in terms of interest, or, how small businesses that don't have that sort of HR bandwidth or function are able to, sort of compare those options?
Yeah, absolutely. I do see the interest is there, right? Like enterprise employers and workforces that want to just make sure their employees have access to something, either in an arrangement where they're making a contribution to that coverage, or maybe in an arrangement where they aren't. But I think Katherine makes a really good point, which is letting people know it is an option, right? And even getting the word out there is difficulty number one. And I think difficulty number two, which we're working hard to change, is just there's a big change management aspect of this. So like it is a different paradigm, right? For an employee to be in that situation, an employer, you're not just dealing with one carrier, you're dealing with multiple different carriers. And you've got to have, I think, the right partners in place in order to really make that ecosystem work, which there's a few more players in that ecosystem than in kind of a traditional group insurance model, I would say. So I think letting people know, yes, that it's an option out there that you should explore and do the analysis, right? Does it make financial sense for you and for your employees, given the market that you're in, right? And then two, getting the right partners in place to be able to guide you through that process. And where it's worked well, it's worked really, really well in our experience. But again, there's a lot of pieces I think that need to come together in order to make that happen.
Thank you. And we do have a question from one of our participants. You talked about when people come in and get information about their options. How do small businesses, where do they go to find out about ICHRA and these other options? Somebody cited in the Q&A, they're using Aetna and the prices keep rising. How do we get small businesses into that position to learn more?
Yeah, I think from my perspective, there's probably a couple of different paths, right? I think, some employers, excuse me, are working with health insurance agents already, right? So like, and some agents are touting these kinds of things more than others for a whole host of reasons. So I would say health insurance agents, right, is one path to go to. You can also go directly to, an ICHRA administrator, they're called, right? And there are several out there whose whole jobs are to help employers through this process, whether they are working with an agent or not, right? They're the ones who you can go to say, hey, help me understand in my market, does this make cost sense for me? Like, let's compare them to the small group rates. How much would I actually offer my employees? Like, that's a question that you don't really know how to answer. They would help you kind of stratify, your employees and figure out how much you might actually want to offer everyone. And then typically they'll partner and help you partner with an enrollment partner like Stride or somebody else to actually sit down with the employees either over the phone or via our technology to help them understand what their options are and get them enrolled in that coverage.
And if they're not already connected with an agent or an ICHRA administrator, is that something they can just Google for their area, or is there somewhere that you direct small businesses to start?
Yeah, I would say that. I mean, that's a good place to start. I mean, there's also places like the HRA Council, which is, something that I'm a part of that, is helping the education and awareness pieces of this as well to help businesses understand what their options really are, or, reach out to me or others right in the industry who can help direct you to the right place.
Thank you. Michael, how have these benefits been received among your small business community? Are folks aware of them? And sort of what from the ground level, what do you think can be done to help spread the word?
Well, the market is where we always start, but we know that it would constantly evolve depending on the needs of the employers and demands of your employees. That's why prior to this event, I also even reached out to, I did talk to Bryan about it a lot. I'd like to know more about Stride Health, because I think it's really, our main focus here would be educating people. And then Dr. Ellen Mons further emphasized that, we need to encourage more people to learn more about what options are there and understand the options. I think that's the best thing so far. And then as far as how do we create this awareness? I could create more meetings, basically focusing on understanding what options is this for the employees and the employers. I think I might even start with Bryan. Our chamber meets regularly, the second Thursday of the month. And then we also have our webinars, whatever. I could even do a hybrid in order for me to reach out to various employers and employees who have certain questions. I think that's the best way.
Absolutely. I think that's a great point. And, why we're holding virtual events like this, but also going, in person to where some of those gatherings of small business owners are and will be happening, to really just sort of get the options out there. Katherine, were you going to jump in there?
Yeah, I mean, I just, I think that's great. And that's really why we're doing this sort of campaign, to do outreach to employers, to let them know about the possibilities for them. And I do think it's kind of hard to reach the population of small employers, which is just such a huge group. So, so many different kinds of industries and, employee profiles. But I wanted to just ask Bryan a question, see if he could talk a little bit about, and I have asked, Stride and others this from time to time, but as you go around and talk to different potential clients and, thinking about ICHRA, maybe thinking about ICHRA versus other individual market options, like taking advantage of the tax credits. And I guess that's sort of one of the big trade-offs. I'm curious if you would be able to characterize, like, what are you seeing as kind of the ICHRA sweet spot lately? Like, what's the industry, what's the firm size, what's the geography where you feel like, okay, this is a likely bet where ICHRA is going to work for them?
Yeah, no, that's a great question. I mean, there are certainly, I think, like we touched on earlier, there's some geographic concentration that we've observed in certain states. I think primarily just because of where small group rates are versus individual rates. I mean, there's states like Ohio, Pennsylvania,
Ohio.
Minnesota, right? There's ones that always pop up for us is like they
Yes.
seem to be hot spots in the ICHRA space. And I think maybe there's an education aspect to it as well. I don't know, but I think it's primarily probably driven by the rates and how they look against each other. In terms of firm size, right? Like I think it's quite popular, I would say, in the under 50 space. And we've seen a lot of interest, like I said, for groups that have never offered insurance before and aren't necessarily required to, but want to do something for their for their employees. But increasingly, I've actually seen an increasing number of applicable large employers as well on the 50 and over space. And I think that's primarily where we're seeing a lot of small group rate hikes, right? Like getting higher and higher up there. And I think a lot of those employers are turning to their agents in a lot of cases and saying, this is too high. Like what other options are there out there? And I think that's where this is entering the conversation, I think, from that perspective. So we're seeing some growth on the larger end of the market as well.
Thank you. One question that we got is specifically about what recommendations do you have for those who are self-employed? I know you're talking about sort of the various stratifications of small businesses, but what can folks who are self-employed, where should they start or what should they know? I don't know if Bryan, if that's the space that you work in.
Yeah, absolutely. I mean, that's where, Stride's been around for a decade or so, and that's kind of where we started, right? Is kind of in that 1099 gig worker space, freelancers, self-employeds, who can come to us and say like, hey, we need some kind of coverage. You're not necessarily having an employer make a contribution in that scenario, but with these increased subsidies and with all these other things, I think helping them understand you are eligible for a subsidy. Here's what that subsidy might be. Here are the options in your area, and kind of layering in, right? Making sure you've got a doctor in network and your prescriptions are covered and all the rest is kind of, that's our bread and butter, right? Of helping people understand, what those things are so that we can get you the coverage that you need.
Great, thank you. Our other panelists should feel free to jump in if you have insights on self-employed or, otherwise. Someone in the Q&A also flagged and said, SBA and SCORE is a great place to contact to bring awareness to small businesses. PPSI has also worked with SBA, but that's a great suggestion for folks who may not already be, connected within that network and getting connected to some of the resources that are available. We've also got questions about the plans that information that we're mentioning. I also just want to flag the research and the report that we've done on benefits also can be found at ppsi.org/healthcare that sort of gets into some of these options. Certainly each of the organizations represented by our panelists, I'm sure, could also share information, but we'll put in the chat, but ppsi.org/healthcare has some of the resources that public-private strategies and has research that we've conducted and a report that we put out in that regard. It is often, pull up one other question is, sort of again about a single LLC business. I think that's maybe similar to the advice about self-employed, somebody who really uses those 1099 approach and independent contractors rather than employees. Is there any other, sort of more specific guidance that you would offer to that questioner?
Yeah, I think I would just add there, I think in addition to serving kind of ICHRA for small business, in addition to serving like individual, I would say freelancers and gig workers and things. There's also partnerships out there for employers who just want to provide that access point, right, to their employees. Like I said, even if they're not making a contribution, to be able to provide some sort of technology solution and access to the individual marketplace for that decision support, subsidy support, everything else to get them access. So I think that's another option, I think, for employers that aren't necessarily in like a full-time classification scenario. I think those options definitely exist.
Thank you.
And Emily,
yes, please.
like to say something. Katherine mentioned it's a little bit hard for them to reach out to small business owners, and I could provide that platform being the chamber president, and we belong to the mother umbrella I was thinking maybe I could forward this recording of this webinar, and then that's something that could be communicated. And then if there's any further requests from them, I might get Bryan or even Katherine involved also and have it scheduled. I think that's the only way we can help further educate people on what options are out there.
No, I think that's great. A great point, and a reminder that when you're talking about both the small business community, it's a very diverse and disparate community across the country, and so this is really sort of this grassroots approach of really reaching out to leaders in the community like yourself, Michael, and really getting an opportunity to engage, whether on Zoom or in person, and share some of these sort of just options and resources. Katherine, we've talked a bit about the outreach side. I'm curious what you would say, what policymakers should keep in mind, when thinking about healthcare policy for small employers. And, we heard from Dr. Mons, but, thinking both about, federal and state policymakers, what they should know, or if there are actions you think would be worthwhile to consider.
I think that a lot of states are really interested in trying to keep good options for small employers, because small employers are just such an important constituency in all states. And I've just been sort of involved with a little bit of activity in New Jersey around noticing that the small group market has become quite a bit smaller than the individual market, and small employers being concerned about options and sort of looking to see if there are some legislative changes to make the small group market a little bit more affordable, and do some of these things, acknowledging that they're very kind of incremental, but then also taking a look at some of these other options and individual market options, and seeing what can they do to make increase awareness. I know that the state of Maine, just as another example, I know when there's a lot of interest sort of from the highest levels of state government to try to help small business in the state. And one of the ways to help small business is to try to help them find solutions to, to find ways to cover their employees, whether it's through the small group market, which I think is what people look to first, but then these individual market options, which I think are kind of the sort of the new frontier of solutions for small employers. So I think some states are stepping in there. Colorado, I think, has really embraced ICHRA because they're just really open to a lot of ways to reduce the cost of healthcare in that state. I mean, that's a real leading state. I think that in Colorado, one of the employer purchasing groups, the Peak Alliance, actually has embraced the idea of ICHRAs and trying to counsel their members about when ICHRA might be good for them. I think in general, employer groups, like large employer groups, purchasing groups, are not that interested in ICHRA, because I think they think more about, sort of all the things that they've invested a lot in, and it would be sort of like walking away from a lot of, their ideas, from kind of a large group perspective. I think one thing I've heard, and I'd be curious to know if Bryan, hears this when he talks to people. I think in terms of ways to maybe fix ICHRAs or make them work even better. Some people have reacted to the age rating issue, and that if you have a lot of older employees, they're going to end up paying more for coverage compared to younger employees, whereas in a kind of a group setting, that's less likely to be the case. And I think there's also just a feeling of like HRA overload. There's sort of too many HRAs, and it's confusing to have more, and it's kind of hard for people to keep them all straight. So I think there are some ways to maybe simplify. I've heard that suggestion. And then a lot of people want to get the tax credit and make the employer contribution. I'm sure that comes up a lot, and that's probably one of the big trade-off points, I would think, for Bryan's customers, thinking about which makes more sense. But those are some things that I've heard about, and I'd be kind of curious to hear what Bryan might say.
Yeah, I think there are some arrangements, especially in the QSERA market, right, on the smallest end. We don't need to get into the nuances here, where you actually can mix kind of subsidy and contribution amount.
Yes.
But it's a good point, though, on age rating as well. I think that's where like an ICHRA administrator can kind of come in and help folks understand. You can classify employees by age and actually offer more contributions on this end and less on this end to sort of try and manage some of that. So I think that's definitely, that's definitely an opportunity to help control for some of those issues that I think are, inevitably, I think gonna come up here and there.
And
I think
Bryan,
I'm sorry. I just
No,
want to say
that's
one
okay.
thing
Go
I
ahead.
think is really missing is sort of testimonials from employees. I mean, I think
Yep.
we don't, I feel like that would be very compelling, because I think one thing employers want to avoid is, having their employees get mad at them. I think, especially in a tight labor market. So I think that, we're not good at counting the number of times these things have happened. So that's one thing that's a problem. But I think another thing is you never really see that employee side of it. So I'd be curious, to know what Bryan might think about that.
Totally agree with that. I think we've seen in some recent studies that employee satisfaction is pretty high on some of these ICHRAs, but I think, right, the power's in the stories, right? Of like, yes, I've been put on an ICHRA, I had to go find my own plan, and I had a great experience, and I ended up with something really, I think you're spot on, and that those stories need to make their way to the forefront as well. And actually, I was going to mention one thing. I remember one of your other comments. I think in sort of the complexities of the reimbursement model and whatnot, I think there are some ICHRA administrators out there trying to make it just easier for folks, because I think there is some HRA overload and getting those reimbursements in folks' pockets beforehand. And there's a lot of different mechanisms to make that happen, because a lot of these employees don't have, frankly, the cash float, right, to go pay for a premium and then subsequently get reimbursed. So there's actually been, I think, a lot of progress made on figuring out ways to make sure that employees don't actually have to pay out of pocket to start with, that that payment is actually covered ahead of time. And I think that actually, it's complicated, right? And there's a lot of moving pieces there, but I think that could be one of the big unlocks of making this easier for employees to get on there and increasing satisfaction as well.
That's great. Thanks.
Thank you. And I realize we throw around a lot of acronyms. Someone in our participants asking, can you please explain what a QSERA is? And I wonder if you could just touch on some of the distinctions there.
Sure. So QSERA is a qualified small employer health reimbursement arrangement. So it's very, very similar to an ICHRA. There are some nuances in terms of what you can do and can't do. QSERAs are typically only for employers under 50. And there are some interesting rules in the QSERA space, like I mentioned, where employees can use a piece of their subsidy from the government in addition to their contribution from their employer. In the ICHRA world, where you're over 50 employees, you have to choose one or the other, right? So you have to either take your subsidy from the government or you take your contribution from the employer. So there's different tax treatments and things in there. Most of the ICHRA administrators we work with, quite frankly, do both and can help folks understand what's the right path for me, depending on your size and the needs of your employee set.
Great, thank you. I know we're coming to the end of the hour. I know we started with really the 10,000 view of the market as it stands. I'd love to, sort of have each of you close, as we're talking about private sector healthcare. Much of the attention is often paid to the large group market. We've spent some time here today digging into the small group and individual markets. But where do you see, sort of looking forward, the future of benefits for small employers, and what would be most helpful to facilitate enrollment and coverage, particularly, germane to this conversation as it relates to healthcare. So, sort of that future of benefits framing that we've been using. Where do you see the market headed? Why don't we start, Bryan and then Michael, and we'll give Katherine the last word.
Sure. Yeah. So I think, like, as I look to the future, I think we touched on this a little bit earlier when I think about what happened in kind of the retirement 401k space. Like I said, that move from defined benefit to defined contribution, it's not going to happen overnight, but I do think there's real power in it, right? I think it has an opportunity to save some employers money. Employees have more choice and flexibility. And I think we get a little closer to what I'd call sort of a portable benefits model, right? Where, as Katherine said, that coverage that you need is not necessarily directly tied anymore to your place of employment. And I think that's, as we think about the future of work, and we work with a lot of gig economy companies as well, I think that's where I see things going, right? A portable benefits model where I don't need to be tied directly to an employer to get the coverage that I need. But at the same time, my employer can still provide contributions where necessary. I think there is a middle ground path there that could power both of those things. And I think, I mean, we've touched on a lot of this, right? But as one of the biggest hurdles, just the education and guidance and awareness to get people to know what their options actually are and to guide them through the process of how, because it can be a little bit complicated, right? Especially to get started. So as companies and employees are starting to navigate that entirely new way of looking at benefits, I think, again, it won't happen overnight, but I'm very bullish on the future.
Great, thank you. Michael.
In order to facilitate enrollment, I would start with education. I think that's the main thing here, educating everyone. Starting from various acronyms that not a lot of people know, QSERA, HRA, IRA. It becomes so confusing for a lot of people. And then we have to weigh the pros and cons over other options and conduct more trainings, whether it's hybrid or in person. I'm willing to provide you the platform. I'm willing you to attend some of my events and even share all this information that we have. I think that's the only way we could create that awareness is by educating a lot of us, understanding more the complexities and what options are out there in the marketplace. Thank you.
Thank you. Katherine.
Thanks. This has been a great discussion, and I really appreciate Michael's point about education. And I'd sort of love to get to a place where employers don't have to think about health insurance so much. I mean, we see large employers thinking about it all the time, and small employers have to think about it all the time. And it all comes from a good place. It's because they want to take care of their employees. But I would love to see a day in the future, sort of as Bryan said, where there is this option. The individual market becomes a destination for people, for a much broader group of people, and employers can sort of understand it. That it's a trusted place, and depending on the situation, they may or may not make a contribution, but it's just reliable. And I do feel like that is a more equitable kind of future where everyone can have sort of similar coverage and the market will be stronger. And I do think we have to think about choice overload in some of these markets because there's so many plans participating, but that's a nicer problem to have than the problems we were having a few years ago. So I do think that, the concept of ICHRA is the right kind of concept. So I'm just, and I think sort of it has not launched in the time that frame that it was sort of projected to, but I do think that it's, consistent with where we want to go from a coverage perspective and sort of an employment perspective. So I'm hoping for the best. And I think that getting some employee stories, and we've been, we're looking for them, frankly, if anybody has any ideas, would be a way to bring the point home to employers that this can be a good thing to do.
Great, thank you. Well, I want to thank all our speakers and panelists today. I think this has been a great discussion and a good reminder that we need to sort of have repetition and a lot of ongoing outreach and education to really support small business owners who are often understaffed and overworked and don't necessarily have time to become healthcare benefits policy experts on top of everything else. So we will have more on this ongoing series and appreciate everyone joining today. Thank you. Have a great afternoon.
Good night.
Thanks
Thank
all.
you.